In line with the World Health Organization guidelines, there are public health measures that must be followed to prevent community spread of COVID-19. This entails undertaking enhanced cleaning and disinfection procedures. Today, we are looking at protocols for disinfection after exposure to COVID-19. I'm Olasunbo Modupe. It's so good to have you on the show. Let's start the show with some COVID-19 updates.
The World Health Organization Director General has said that vaccine nationalism would only slow the effort to squash the pandemic and called for vaccines to be fairly used and effectively. The DG said 78 high-income countries have now joined the COVAX Global Vaccine Allocation Plan, bringing the total to 170 countries, and the number is growing. He urged others to join by the September 18 deadline for bidding commitment. He added that joining the plan guaranteed those countries access to the world's largest portfolio of vaccines, with 9 candidates currently in the pipeline, as 4 were promising. The WHO and the Gavi Vaccine Alliance are leading the COVAX facility, aimed at helping buy and distribute vaccination shots fairly around the world. But some countries that have secured their own supplies through bilateral deals, including the United States, have said they would not join COVAX. The Nigeria Center for Disease Control has announced the inclusion of 2 new labs to the molecular laboratory network. They are the Federal Medical Center Kefi in Nasarawa State and the Total Biomolecular Lab in Rivers State. Testing at any lab in the NCDC network is free of charge. The Lagos State government has reopened 2 of its recreational parks for public use after several months of closure due to the COVID-19 pandemic. Both parks now available for public use are the Ndubuisi Kanu Park in Alausa and the Dr. Abayomi Fini Park, Oregun, both in Ikeja. The number of occupants of the park is restricted to 150 and 100 respectively. Children below 5 and adults over 65 years of age are advised to stay away from the parks. All play items and games which involve physical contact will also not be operational in the parks until further notice. Globally, over 27 million confirmed cases, more than 800,000 deaths, and above 19 million recoveries have been recorded. In Nigeria, more than 55,000 cases and over 1,000 deaths have been confirmed.
Still Sound Health on Lagos Television. Today, our focus is on environmental cleaning and preventive measures for COVID-19. I am now being joined via Skype by Dr. Tolu Olufunlayo. Dr. Olufunlayo is a senior lecturer and honorary consultant, Department of Community Health and Primary Care, College of Medicine, University of Lagos, and Lagos University Teaching Hospital. She is also the chairman, Association of Public Health Physicians of Nigeria, Lagos State Chapter. Welcome to the show, Dr. Olufunlayo.
Thank you very much. I'm happy to be here.
Okay, to start with, is cleaning alone recommended and effective after exposure to COVID-19?
Well, cleaning is definitely an important measure for the prevention of the spread of COVID-19, but it must be used in conjunction with other measures for a total comprehensive strategy against the spread of COVID-19.
Okay, so what should be the protocol after someone has been confirmed with COVID-19?
Okay, Well, when someone has been found to have COVID-19, it's very important for the person to be isolated and treated appropriately. Okay. Now, the isolation could take place either in a designated facility for such purposes, those are isolation centers, or if the person meets certain criteria, then the person could be managed at home, what we call home management. And this is because COVID-19 has a high proportion of cases being asymptomatic, that's not having any symptoms or having only mild symptoms. And because of the large numbers of cases that have been experienced both in Nigeria and around the world, sometimes the numbers of people that have COVID-19 outstrip the resources for isolation in a health facility. And that's why home management has been instituted. Okay. Of course, after they've been isolated, they'll be treated and then later on retested to confirm that, they are no longer having the virus. But after that, it's important that, the areas that they are in are cleaned effectively to prevent spread from one person to the other. So during the isolation period, as well as when they have become, well, it's important for those areas to be cleaned and cleaned appropriately.
Okay. How long must a facility be closed after it has been exposed to COVID-19?
Okay, so let's take an example. Let's say it's a school or a workplace or a health facility. It depends on several factors. Let me start by saying that COVID-19 is a virus that is transmitted mainly by droplets. Okay, that's little drops from the person's respiratory tract, that is the nose and the mouth. Okay? And these droplets don't travel very far. They usually fall to the ground within a few minutes. In rare instances, there can be airborne transmission, but that's only in a few circumstances. The other way by which COVID-19 can be transmitted is through contact with infected surfaces. That's surfaces where COVID-19 may have landed upon from somebody who is infected. So what would determine when, how long a place is closed after an infection has taken place is the situation within that place. First of all, you want to make sure that the place is cleaned and does not have, a virus that other people can then come in and, get infected by. Then the second thing, of course, is the human beings or the personnel that are within that facility, whether it's a school or an office or a health facility. If there is likelihood of spread, i.e. if that person has had contacts with other people prior to the time he became infected or just at the time he was becoming infected, then you need to take care of that. That can be taken care of by contact tracing. Now, sometimes it's not clear who has been in touch with the person, and that's sometimes what informs closure of facilities for 1 week or 2 weeks. Now, what does that mean? The incubation period, that's the period within which the virus stays in the body before it starts showing symptoms or develops the disease, in people ranges from between 2 days to 14 days. So if you are not sure of exactly who that person came in contact with in your office, and you don't want other people popping up 3 days, 5 days, 7 days, 9 days, and so on and so forth after that person got, infected, then some people will just take the decision to close the facility. And that was what we saw frequently at the beginning of the pandemic. Oh, there was a case of a health worker in this place and the hospital has been closed down for 2 weeks. But it's not necessarily always for you to close that facility. What is more important is for you to aerate, let there be adequate ventilation within that facility so that if there's any virus in the air exchange can take it out and make it fall to the ground. And then there needs to be appropriate cleaning and disinfection. Cleaning and disinfection are two slightly different things. Cleaning is using your regular detergents and water. Okay, and disinfection is using other chemicals. However, in infection prevention and control, we usually say that it's better for you to clean first before you disinfect, because sometimes if there's any dirt or organic material in that area and you apply the chemicals, they will not work unless they are first of all cleaned. So it's usually first of all clean and then you disinfect. And these are procedures that people have to be trained on to know exactly how to do it. But in general, we talk about, if you're talking about when a person has been infected, then it has to be done with quite a bit of skill so that those people who are cleaning do not get infected. But what I want to also say about COVID-19 is that the virus is quite easily taken care of by cleaning and disinfection. It's a virus and it has an envelope. And what happens is that when you use the action of soap and water on the virus, it easily gets destroyed. That's the good news about COVID-19. So if people are taught to properly clean and disinfect regularly, and especially after a case, and then the place is ventilated, then you should be able to have in soon after, once you have been able to take away any other exposed people who should also be asked to, quarantine themselves.
Okay.
I don't know if this is a clear explanation.
Yes. Okay.
to your question.
Okay. So can anybody just go to the market or supermarket to get a cleaning, some cleaning products to disinfect? What should be the basic protocol if you're going to disinfect or clean a facility?
Okay, a facility, are you talking about a house or a
house?
workplace?
It could be a house, a workplace, school.
Okay, let me take a school as a typical example now, because a school is a place where many people come into and go on a regular basis. So for schools, the recommended protocol is that the communal areas should be cleaned and disinfected twice a day, while the boarding facilities should be cleaned and disinfected once a day. And we're talking about, for cleaning, soap and water. And then for the disinfection, it would either be a 0.1% bleach solution. That's 1 part bleach to 10 parts of water, or 9 parts of water, 1 in 10. Or, occasionally one can also use alcohol to disinfect high-touch surfaces. What we mean by high-touch surfaces are surfaces that a lot of people, go to at the same time. Handrails, doorknobs, light switch, shared computers, and other shared utensils, tables for where people sit to eat, and so on and so forth. Okay. Taps at sinks where people wash their hands, etc. So those are the high touch surfaces. So if anyone is going in to buy any of these materials, really, they should just be buying soap and bleach, and maybe a bottle of alcohol, ethanol, the one we use, spirit, methylated spirit, okay, and then a lot of water. So essentially, we just need simple water and sanitation facilities to be able to take care of COVID-19. And like I said earlier, you just first of all have to clean the area and then you disinfect.
Okay, so Dr. Olufunlayo, what is your take on other disinfection methods such as ultrasonic waves, high-intensity UV radiation, LED lights, and the likes? Because we see a lot, we see all sorts these days during this time.
Okay, ultrasonic waves, LED lights, UV lights, and so on. Some of these methods have been developed to disinfect or sterilize very specific things, like some forms of equipment. They are not the most reliable methods, but they may be used in those specific cases. However, in ordinary instances, day-to-day living, they are not recommended, especially for the body. They are harmful to the body. Lights like that and rays like that shouldn't be used for disinfecting the body. And when it comes to issues of spraying chlorine like disinfection tunnels, okay, that is a very important thing to discuss.
Okay.
It's, first of all, I told you that COVID-19 is transmitted mainly by droplets. It's a respiratory tract infection. So if somebody is going into a building and he walks through a disinfection tunnel, what happens is that his body is cleaned. Okay, his body is affected by the chlorine, but not the respiratory tract where the organism comes from. So at best, it does not tackle the virus where it is found. It may be used in some other infections in which there's transmission by contact, but for contact of bodily fluids and so on. But for COVID-19, that is a respiratory virus, disinfectant tunnels at best have little or no effect. But it's also found that some of these chemicals that are used in the disinfectant tunnels are harmful. They can cause contact irritation, skin irritation, respiratory problems, eye problems. There are some studies that have shown this. So why do we want to expose people to all these harmful effects for something that is not likely to help us prevent the spread? I must also say that if you or I walk through a disinfection tunnel, you feel that, you've taken care of everything. So you're not going to be looking out for the simple measures like hand washing and cough etiquette, which are actually the major things for preventing the spread of COVID-19.
Yes.
And so in many countries of the world today, and of course the World Health Organization, disinfection tunnels are not recommended as a preventive measure against COVID-19.
Okay. The lockdown will be phased out sooner or later. To avoid a new wave of infection, what is your advice in terms of strict adherence to precautionary measures?
Okay, that's a good one. For precaution, as we continue to open up, which we have to do because the society has to keep on living. We can't kill the economy, as everybody has been saying on the media. So there's responsibility to the government and there's also responsibility to the populace. The government will need to strengthen the strategy to test, trace, isolate, and treat cases of COVID-19. As you know, the country's target for testing has not been met at all. We are far below the target that we said we are going to be at this point in time. And we need to be able to test much more if we want to have a good idea of the actual COVID-19 infection in our country. We haven't really been able to do that, so we must do more. There must be contact tracing. Remember I told you about that earlier? Yes. So we need to know who has been in contact with people who have COVID-19 so that we can stop the spread as much as possible. And then those that have must be isolated so they don't spread it to others. And they must be supported through the period of the infection so that as much as possible, many people recover and get well after having COVID-19 if they do have it. So that's the side of the government. Of course, they also have to continue to support the economy, provide palliatives to people who are vulnerable, and so on and so forth. But for the people, for you and I, every man on the street, it's our corporate responsibility to make sure that we are safe for the next person and we do not infect the next person. And so we have to keep on adhering to these preventive health and social measures that have been handed down to us by the government. Very, very important. And these are hand hygiene, washing your hands with soap and running water for at least 20 seconds, or using an alcohol-based hand rub as frequently as possible, and especially after touching anything. Cough etiquette. Cough into your elbow, okay, or into a tissue which is disposed of immediately to prevent spreading the virus. Remember that The virus is in the respiratory tract. So if it is going to spread, it's going to come from there. Physical distancing, very important. And these are some of the things that we are not really adhering to anymore. We should have a distance of at least 2 meters between ourselves and any other person. Then avoiding large gatherings and enclosed spaces. And of course, the one that a lot of people are complaining about, use of face masks, covering the nose and the mouth. A lot of people comply with the guidance to have a face mask, but they don't put it on properly. I saw a report recently of students complaining that during their exams, the mask was uncomfortable. It may be uncomfortable, but it doesn't stop us from breathing. We doctors wear them for all our procedures, that require them, and we just put them on. We have gotten used to it. So Nigerians need to get used to the fact that this is for our common good. If I wear a mask and you wear a mask, I protect you and you protect me. So let's put on our masks and face coverings when we're in public places. For students that are going back to school now, they have to keep their masks on whenever they are together with students. So they have to keep their masks on in the class during the exams. They can't wear it to pass through the gate and then immediately they get into the class, take it off. Same thing with the teachers. So I think if we combine all of these things with environmental cleaning and disinfection when necessary, we'll be able to, mitigate the spread of COVID-19 in Nigeria.
We sincerely appreciate your time and resources on Sound Health, Dr. Olufunlayo.
Thank you very much for having me.
Thank you so much for your time. I have been talking to Dr. Tolu Olufunlayo, a public health physician, on the procedure after exposure to COVID-19. She shared her expertise on environmental cleaning and preventive measures for COVID-19. Sound Health continues with trending health news reports. Please stay tuned. It's still Sound Health on Lagos Television, and I'm Hola Sumbor Modukwe. Report early enough if you have been exposed to COVID-19. Please join hands with the state government to flatten the curve. do not increase the statistics by adhering to all precautionary measures against COVID-19. For comments and enquiries, please send SMS to 0035826603 or follow us on social media at TLTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.